Hi everyone, my name is Seema Kacker and I'll be presenting work from my PhD dissertation on the effective information about prior free care on demand for cataract surgery in Kenya. Cataracts are the #1 cause of blindness worldwide, even though surgery is a safe and effective fix. Without treatment, people with cataracts will go blind, and this disease progression is costly to both patients and their caregivers. In low-income contexts, surgery is often provided for free or very low cost through charity or donor-funded eye camps, although these services are sporadically offered, and care is increasingly available through local private providers. In general, willingness to pay for the surgery is quite low, and patients often wait very long periods of time for free services to come to their communities, instead of seeking potentially non-free care directly from a hospital. In this study, we explore the possibility that care-seeking behavior is context-dependent, focusing on the role of information about previously offered prices. Our approach is based on standard random utility theory, in which systematic utility derived by person I from any given offer j is a function of the offer's attributes, and the person simply will choose the offer that yields the highest utility. In our approach, however, we incorporate two additional effects, a reference effect and a salience effect. We define a reference effect as the additional utility or disutility from an offer being perceived as a good or bad deal, and we characterize salience by the relative contribution of an offer's price to its valuation. We also allow this salience effect to be different and potentially greater for contextual information about a prior zero price. Incorporating these two effects yields the equation at the bottom of the slide, which we estimate as a mixed-logit model. We test this model of context dependence using a large field experiment in an urban slum outside Nairobi, in which we randomly assigned household financial decision makers to information about how much a standardized patient had paid for cataract surgery. Either they were provided with no information about how much the patient paid, or they were told she paid nothing, that she paid the equivalent of $50, or that she paid the equivalent of $100. Respondents were then asked to state their preferences for a second standardized patient using a discrete choice experiment. They were told to assume that they were financially responsible for this second patient and needed to decide which surgery to select. The choice experiment involved a series of 12 choice tasks, each composed of a set of 2 alternative surgery offers, characterized by the attributes and levels shown in the table on the right-hand side of the slide. For each choice task, respondents first chose between the 2 offers, assuming they had to pick one, and then they repeated the choice, but this time with the option of choosing neither. We find that demand for cataract surgery is significantly lower among individuals who were told that surgery had been available for free than among individuals who did not receive prior price information. We find no effect, however, for any of the other price information treatments. The figure on the upper right part of the slide shows that receiving zero price information decreased demand by 6 to 15 percentage points. At an offer price of $250, this corresponds to a 21% decrease. When we look further at our data, we find that this treatment effect is driven by the wealthier respondents in our sample. You can see in these 3 figures at the bottom of the slide that among respondents reporting an income of less than $100 per month, there is no effect of zero price information, but we see a large and significant effect among the wealthiest 20% of our sample, shown in the rightmost figure. Among this wealthiest group, demand for surgery offered at $250 drops by 50%. So what does all of this mean? We see a robust effect from giving individuals information about the amount previously paid for cataract surgery on demand, but only when that amount is zero. Our results are consistent with a reference effect, but the fact that we see this only with the zero price group suggests that there may be something specific to zero prices that makes this information salient. Furthermore, this effect is not observed for the lowest income respondents, who we might otherwise think would be more price sensitive than wealthier individuals. This finding aligns with recent work suggesting that poverty induces a scarcity mindset, in which cognitive bandwidth is largely taken up by immediate trade-offs, and context, including something like externally provided prior price information, is largely ignored. We'd love any feedback you have to offer on our work. My contact information is provided here. Thank you very much.